Shrink your prostate naturally. Managing benign prostatic hyperplasia, BPH, with natural solutions. Welcome to this in-depth video where we'll be diving into how you can manage an enlarged prostate, or benign prostatic hyperplasia, BPH, without resorting to surgery. We'll discuss proven natural strategies and lifestyle adjustments that may help reduce prostate size and improve your quality of life. We'll also cover one vitamin that has shown promise in supporting prostate health. By the end, you'll have a comprehensive understanding of holistic, evidence-based approaches to managing BPH effectively. Understanding BPH. Before we get into the methods to shrink the prostate, it's essential to understand what BPH is and why it occurs. The prostate is a small gland located between the bladder and the penis, surrounding the urethra. This gland produces seminal fluid, which nourishes and transports sperm. As men age, the prostate often enlarges, which is a condition known as BPH. BPH is quite common, affecting around 50% of men over the age of 50 and 90% of men over the age of 80. Although it's not a life-threatening condition, BPH can cause urinary symptoms that significantly impact quality of life. Common symptoms include frequent urination, especially at night, difficulty starting or stopping urination, a weak urine stream, and a feeling of incomplete bladder emptying. Why surgery isn't always necessary. When diagnosed with BPH, many men are concerned about surgery. Thankfully, surgery is usually a last resort and is generally recommended only when symptoms severely affect daily life. Many individuals can manage BPH effectively with lifestyle changes, natural treatments, and sometimes medication. The goal of this video is to empower you with tools that may help manage BPH naturally so that you can improve your symptoms without the need for invasive procedures. Natural strategies to help shrink the prostate. 1. Dietary changes. Diet plays a crucial role in prostate health. Some foods can exacerbate BPH symptoms, while others may help reduce prostate size or alleviate symptoms. Anti-inflammatory foods. Chronic inflammation can worsen BPH symptoms. Consuming an anti-inflammatory diet rich in fruits, vegetables, whole grains, nuts, and seeds may help. Foods rich in antioxidants, such as berries, tomatoes, and green leafy vegetables, are excellent choices. Healthy fats. Omega-3 fatty acids found in fish like salmon, sardines, and trout may reduce inflammation in the body and support prostate health. Avoid trans fats and limit saturated fats, which can contribute to inflammation. Cruciferous vegetables. Vegetables like broccoli, cauliflower, Brussels sprouts, and kale contain compounds that support hormone balance and may reduce the risk of prostate enlargement. They are rich in sulforaphane, a compound with potent anti-cancer properties. Tomatoes. Rich in lycopene, a powerful antioxidant, tomatoes may benefit prostate health. Lycopene has been associated with a reduced risk of prostate enlargement and may even slow the progression of BPH. Cooking tomatoes, such as in tomato sauce or soup, increases the bioavailability of lycopene. 2. Lifestyle modifications. Regular exercise. Physical activity can improve blood flow and reduce inflammation, benefiting prostate health. Studies have shown that moderate exercise, such as brisk walking, swimming, or cycling, can help alleviate BPH symptoms. Weight management. Obesity is linked to an increased risk of BPH and more severe symptoms. Maintaining a healthy weight can reduce the pressure on the bladder and improve urinary symptoms. Reduce alcohol and caffeine intake. Both alcohol and caffeine are diuretics, meaning they increase urine production and can exacerbate urinary frequency and urgency, especially at night. Limiting these can provide relief for some men with BPH. 3. Hydration timing. Monitor fluid intake. Staying hydrated is essential, but drinking large amounts of fluids before bed can increase nighttime urination. Try to drink more fluids during the day and limit intake a few hours before bedtime to reduce nighttime trips to the bathroom. Supplements and herbal remedies. Several natural supplements and herbs have shown promise in managing BPH symptoms. However, it's essential to consult a healthcare provider before beginning any supplement. Saw palmetto. This is one of the most well-known natural supplements for prostate health. Some studies suggest that saw palmetto may improve urinary symptoms by inhibiting an enzyme responsible for prostate growth. The usual dose ranges from 160 to 320 milligrams per day. Pygeum africanum. Derived from the bark of the African plum tree, pygeum has been traditionally used to treat urinary issues. It may help reduce nighttime urination and improve overall urinary function. Stinging nettle. Stinging nettle root has been used in Europe to alleviate BPH symptoms. It's thought to work by reducing inflammation and acting as a mild diuretic, helping to relieve urinary symptoms. Beta-sitosterol. This plant sterol is found in many plants and has been shown to improve urinary symptoms associated with BPH. It works by inhibiting the production of dihydrotestosterone, DHT, a hormone that can contribute to prostate growth. One vitamin that may support prostate health. Vitamin D has gained attention for its potential role in prostate health. Several studies suggest that adequate levels of vitamin D may help reduce the risk of prostate growth and support overall prostate health. How vitamin D helps. Vitamin D is essential for immune function, and low levels have been associated with an increased risk of various diseases, including prostate issues. It may have anti-inflammatory effects and help regulate cell growth, which could be beneficial for managing BPH. Sources of vitamin D. Vitamin D can be obtained through sun exposure, foods like fatty fish, fortified dairy products, and supplements. Many people, especially those living in northern climates, may benefit from a vitamin D supplement. The recommended daily intake varies, but a common guideline is 600–800 U per day. However, you should get your vitamin D levels checked by a healthcare provider to determine the appropriate dosage. Stress management and prostate health. Chronic stress can lead to increased levels of cortisol, a hormone that can exacerbate inflammation and worsen BPH symptoms. Implementing stress-reducing techniques such as meditation, deep breathing exercises, yoga, and spending time in nature can be beneficial. When to see a doctor. It's crucial to remember that while natural remedies and lifestyle changes can be very effective, they may not work for everyone. You should see a healthcare provider if you experience severe symptoms, including inability to urinate, blood in urine, painful urination or ejaculation, sudden or severe worsening of symptoms. A doctor can provide additional options, including medications like alpha blockers and 5-alpha reductase inhibitors. These medications can help relieve symptoms or slow the progression of prostate enlargement. However, they may come with side effects, so it's essential to discuss the pros and cons with your healthcare provider. Medical disclaimer. This video is for informational purposes only and does not constitute medical advice. Always consult with a healthcare provider before making any changes to your health regimen, especially if you are taking medications or have underlying health conditions. Until next time.